Welcome. I'm Robin Tiger, and I'm a physician and founder of Stress Free MD. And I'm really, really honored that you've taken time out of your busy schedule tonight to come here to check out, this program. And I just wanted to commend you for all the work you're doing during this really difficult time. I mean, being a doctor is difficult enough, it's stressful enough, and then on top of everything, we have the pandemic, which isn't going away anytime soon, right? We've got this Omicron, and I know some of my family members have it, and it's just looming and getting worse and worse. So anyway, I just want to thank you for being here. Thank you, Dr. Lipson, for being here as well. Welcome. And I wanted to just find out where you're from. So if you can just put in the chat box what your specialty is and where you're from so I can get an idea. I would love to know that. I'm here in Asheville, North Carolina, and my specialty is diagnostic radiology. And I actually transitioned into this space of stress management education and self-care education about a decade ago, after I experienced my own burnout story and was seeking ways to relieve it. And when I found out how to take care of myself, I just started sharing it with as many doctors as I can over this past decade, which has been hundreds, maybe even thousands at this point. Okay, as a rheumatology and oral medicine, radiation oncology, thank you for sharing that. Okay. Miami. Oh, I hope it's beautiful there. All right, so anyway, because of what's going on, because of what's happening, I wanted to pop on the day before New Year's because we have issues, right? And I'm getting so many questions from so many docs, particularly this time of year when there tends to be more stress. And now we've got the pandemic and they're saying, okay, 2022 is coming, and like, what can I do for myself? I hear you've got this program. I hear people talking about it, and I've got so many questions. I said, let me just pop on, and even if they registered and aren't here today, they'll get the replay and they can just hear it all at once. So what's been going on with the docs that have been coming through? Well, I call it RX Inner Peace. That's you write your own prescription for your self-care, and that's the prescription of your toolbox, your evidence-based tools, all that stuff that we were never taught. So we were taught lots of anatomy and physiology, but we were actually never taught how to use any of it. We weren't taught that we can actually take over our hijacked bodies, our autonomic nervous system, and find homeostasis when our stress response is going haywire. We were never taught how to work with our mind and all those thoughts, all those words that our brain tells us. So in this last decade of my teaching, I've been predominantly live. I've been giving workshops and doing grand rounds and lecturing and doing courses and programs. And physicians would frequently say to me, wow, that was amazing, but I can't remember what we just did. Can you make me a video? Or I can't make it to anything that you do because I'm always on call, or I've got stuff with my kids, or I've got a board meeting. Can you make a video? So when COVID hit last year, and I have to give you the backstory also, is that at that point I had 3 physician friends die from suicide. I said, all right, now's the time. I'm anticipating a lot of worsening of what's been going on, and that I expect that we are going to have even worsening of our 50% burnout. Now we know it's 2/3. Depression is 89%. Physicians are on the depression scale, 89%. That means only 19% of physicians are not describing any sort of depression, and less than 1/3 of physicians are caring for themselves. And this is all from Medscape. So I did what physicians were asking for. And as a doctor, I know how physicians learn best. As a doctor who's been teaching physicians for years, the way that we all learn best is, first of all, short, okay, because everyone's super busy. So I took everything I've been teaching and put it into very short, I like to call them snacks of information. And the way I decided how long they should be is I asked docs, well, how much time do you have on any given day for yourself? And physicians would say, well, probably 15 minutes, like, all right. I got you. So all the lessons in my program in general are 15 minutes or less. Some are just a few minutes in length. This way you can learn something new very quickly. And the language that I'm sharing with you is language that we understand, language based on our own physiology, our own anatomy, the way that things work in our bodies, and based in the literature. And so the program itself is formed by all of these short, in general, small bites of information of videos that you can watch as many times as you want without any expiration. Lots of programs, you only have a certain amount of time, but this is no expiration. And then, well, what do we do about our mind and all of our thoughts? And so that's where the live coaching comes in. And so we have live group coaching where you get to meet other docs going through the same thing. I've had docs currently in 5 different time zones in the program, all the way from Alaska to North Carolina, and private coaching with me. That comes with 2 one-on-one private coaching sessions. So that's what RX Inner Peace is. That's how it formed. That's the story. And it started last year during the pandemic. And then docs were asking for CME. I said, okay, all right. Yeah, you deserve to get credit for taking care of yourself, right? And so University of North Carolina welcomed me with open arms, and they said, okay, we're ready, let's do it. And they accredited the program for 25 CME. Okay. So now we've got CME, which means it's covered, right? You get it paid for by your CME account, take it as a personal development expense. You get credit for taking care of you. And I actually met with the Surgeon General's office, the Chief of Staff of Surgeon General, Dr. Murthy's Chief of Staff, and I met last week, and we talked about this. And he was very interested in setting me up with the next meeting, because he basically said that, you know, they have a national agenda for physician wellness right now. And he said that my work and perspective enhances his team's work. So I'm meeting with his director of operations after the new year. So we got the Surgeon General backing this. And that's at a national level. And well, you just have me here all to yourself. Okay. So let me bring on the videos. Let me bring on the program. Let me show you what's going on. Okay, I'm going to share my screen. And I'm going to pull this up. Here we go. So this is inside the RX Inner Peace program. So once you register for the program, you receive information to create your own unique link. You create your own unique link, and that gets you logged in on any of your devices. That could be your tablet, your PC, your desktop, your laptop, your phone. I actually had one internal medicine physician who, in between her recertification for her internal medicine boards, she was so stressed out on that break, she went into her car and pulled up some of the videos on her phone, a short meditation and a release of tension for her neck and shoulders. And then she went back into the exam and said it was amazing. She felt great and was able to finish it much more relaxed, much more comfortable. So yeah, even your phone. Okay, so when you log into the program, at the top here, your contact resources. And this tab is how you reach me and the links to our private and our group calls. You schedule your private one-on-one sessions at your convenience at times that work best for you. And then there's references. And so I have 10 pages of references, and it's references for a lot of the things that we talk about in the program. If you want to dive further, whether it be coaching, whether it be stress, whether it be pain, and so on, telomeres, how it affects your longevity, and so on. And then we have the modules. And so on the left-hand side, you'll see 8 modules. And these refer to the same categories of lessons, but different lessons in those categories for all 8. And each module contains a lecture. So on the first one, we start with the stress response, and that's actually divided into 2 parts. And then I'll give you introductory lectures in the first module, because everything I'm introducing to you may be new. So there are more lessons in the first module because there's introduction. So mudras are hand gestures, and then we have a meditation. See, 4 minutes, 14 minutes, right? Pretty short. Intro to morning meditation, right? I get a lot of people saying, I don't know how to meditate. I can't sit quietly. My mind is too busy. That's uncomfortable. Who wants to do that? Well, you don't even have to think about it because I'm giving it to you. I'm talking you through these meditations and they're very short. 15 minutes every morning. That's it, right? Different breathing tools, right? I teach you, I think, 18 different breathing tools. Your breath can calm you down, can wake you up, it can cool you off, it can heat you up. Most of what I teach you is for calming, a couple for wakening you up. And then the next subject that we go through are somatics, and this is amazing. Somatics is a very different way of movement. It's the opposite of stretching. And in somatics, you're able to actually release chronic tension in your body. That's what that internist was doing during her internal medicine recertification exam. She was in her car and she was doing this series to release her neck and shoulders. And then I teach you daily, a daily practice. The first one, notice it's from the chair and the floor, and that's because sometimes people can't get on the floor. And this way, UNC said, oh, wow, it's from the chair, you can teach your patients what you learned. So they love that ripple effect. The next subject are self-regulation tools. And these are based on the homunculus, the way that our body is mapped in our brain. The way our body's mapped in our brain. It's fascinating what we can do, how we can work with our own bodies. Our hands and our mouth, for example, take up a large portion of our body. So when we work with our hands and our mouth, we can have a quicker relaxation response. And then meditation, another type of meditation called iRest. And this form of meditation was initially created for Walter Reed Army Hospital. And it was to help our military relieve symptoms of PTSD. It was found to be so helpful for that in 2010, our Surgeon General and the Department of Defense declared iRest meditation a Tier 1 treatment for chronic pain. They found it equivalent to taking opioids. It was that powerful. You can just mute everyone, that would be great.
Дяка, замолчи. Тебя слышу. Тебя слышно.
Welcome to whoever just came in. And if you can mute yourselves, that would be great. Thank you. And then I give you some guided meditations for daytime and for sleep. And the meditations are very different for daytime and sleep. The only lessons that are longer than 15-minute range are the ones at the end of each module where I incorporate everything that you learned in the module into one full-length lesson. And again, they're taught from the floor and from the chair. So welcome to doctors who just came in. I'm just going over what the RX Inner Peace program looks like on the inside. All the modules are set up the same way because we're doctors and we're box checkers and we like things very organized. So the same exact subjects are in each module with different lessons in each subject. So we have a lecture, we have different types of meditation, we have different types of breathing tools, we have movements to relieve chronic tension. This is the second half of your daily practice, which takes no more than 10 minutes once you learn it. Different breathing tools. Sometimes there's one, sometimes there's two. Self-regulation tools. Meditation, which has 10 steps, and I take you through the steps. There are some worksheets you can work through and meditations related to those steps. Full-length practice. We throw in some Qigong, inside and outside, and then there's a journal, which I didn't mention in the first module, but it's at the end of each module, and it's really just for you to keep track of what you're doing, really rating your anxiety, morning and night, how your sleep is going, and some prompts for you to take notice each day. What tools are working for you? What tools would you like to remember? What kinds of things are working for you? Because as I get to know you better, I can even find more tools that work for your body. Some people are visual learners. Some people are tactical learners, right? Some people like a combination. Okay. At the end in Module 8, after you've gone through everything, you claim your CME credit, and that's here at the bottom. There's a post-test, which is super easy because no physician has ever not passed it. The questions are really just from the program. AMA requires it for your CME. We do a pre and post Maslach burnout inventory, and then you have your CME credit form that goes to University of North Carolina for you to get your 25 Category 1 CME. Okay. So while I'm still in the program, do you have any questions before I stop my share? Okay. If something comes up, you can just ask me and we can go over it. So that's the video component of the program. And the video component, like I said, 8 modules, very organized because we're box checkers, same subject matter for each, the category of subject for each one, different lessons in each category. And that goes on for 8 modules. You have 6 months to get it done. Doctors have finished way before that, but some, take the full 6 months because that's what they choose to do. The beauty of this program is that it's self-paced. You get to learn on your own pace, on your own time, which, however, it fits into your schedule. We do group calls weekly, which are optional. And if you miss it, there's a replay. And then you schedule your 2 private one-on-one 1-hour sessions with me at your convenience. Okay. So any questions up to this point? Anything at all? All right. So I forgot to mention also that the group calls have no expiration. So I have docs that have already finished several months ago and they still pop on for the weekly group calls. So just know that the support doesn't end after the program is over. So this investment in this program is backed by the AMA, right? It's CME accredited. Our own Surgeon General's office supports this need for self-care education, which is what I mentioned earlier. I'm so honored and privileged to be involved with our Surgeon General's office and the Chief of Staff to work at a national level to provide physician wellness and self-care education to prevent and relieve burnout and all that goes along with it. And the return on investment, the ROI is amazing. So physicians who have come through this program are less stressed, they have calm in their lives, they're balanced, they say they don't know what they would have done, particularly during COVID without this program. Some physicians have actually stayed in their marriage because their marriage was on the rocks based on what was going on in their medical practice. Their kids think they're cool again, they love spending time with them. Physicians are sleeping, they're rested, they're getting their charting done while they're at work, they're not bringing it home anymore, right? They have focus and concentration. They're not walking into a room and not remembering why they went in there, right? They're not forgetting. They're much more patient. They said they even have more patience for their patients. The piece of anger, that intolerance, that reactivity is gone. That whole edge is off. And because they're decreasing their stress response, several physicians have actually lost weight. Some of them come to me from weight loss programs, and their weight is actually coming down in this program because we know stress is associated with eating the wrong foods and putting on all that fat in your body and gaining weight and so on. So it's pretty awesome, the wonderful ripple effect of the things that can happen once you learn how to relieve your stress response. Okay, so I want to also share with you that the incentive for you showing up live is that I promised you a $500 gift. So only those individuals who showed up live are getting this gift. And that gift is a 3rd private session with me, which are very coveted. I can tell you that physicians actually have finished their program and have continued to privately coach with me because they have found these sessions so beneficial. So If you register for this program by midnight tonight, you will receive a third private session with me for your program. You only get 2, but you'll get 3 if you register by midnight, and it's a $500 value because private sessions with me are $500. So it's just me wanting to give that to you because I really do care. And I really want 2022 to be your year where you become the best version of yourself, independent of what's happening with the pandemic, independent of what's happening in the healthcare system, which we know is broken, independent of anything that's happening politically or in the world or whatever may come your way. This is my gift to you. Okay, so I'm going to put the link to register in the comments, and then if you have any questions, you can just let me know, and I'm happy to answer that for you. So let me just stick this link in the comments for you. It'll be easy access in the chat box rather. And this is the direct link to register. So again, if you register by midnight tonight, you get an additional free session with me, which is a $500 value. Okay. So do you have any questions? Jillian, any questions for me?
No, not yet. I can't wait to look at the site though, and I appreciate you putting on this event.
Oh, sure. Looks like we have another doctor popping in. So let me see. What? Since you've been on the whole time, hello, Dr. Marr. Since you've been on the whole time, Jillian, if Dr. Riker, am I saying that right? Riker?
Oh, please call me Jillian.
Jillian?
Yes.
Okay. Jillian, just if you can share with me, do you think this was worth your time, and what would your biggest takeaway be from just popping on tonight?
Yeah, absolutely. I think anytime you connect, I went through severe burnout. I changed my specialty as a result. And just when I was going through burnout, it was 2014 to 17 and no one talked about it. And just the opportunity to talk to somebody that's doing something about it, and the community is extremely valuable. So yes, anytime I get to connect with a fellow physician that gets it and is taking action, certainly is worth it. So thank you.
Thank you. Thank you for that. Yes, I feel the same way. And my burnout was probably about 15 years ago or so when it really came to a head. And it was time that nobody was really talking about it. I didn't even know that anyone else felt like me or what was going on. So once I had all of these symptoms, crazy symptoms that I couldn't put together, I was the most complex case that you can imagine, including paresthesias. I thought I had some neurologic disease. My hands would go numb during a breast biopsy, during cutting up vegetables or what have you. And it was all just stress, chronic stress. So I relieved everything, my migraines, my reflux, my body pain, my paresthesias, my negative thought loops, suicidal ideation. I mean, you name it, I had it all, and it's all gone. So it's been pretty amazing. And so many docs that I've met in this last decade that I've been sharing these tools with have relieved their symptoms as well. So there's no other diagnosis other than chronic stress. And what we need to do about it are the tools that we were never taught in medical school. And just really so happy to have seen the transformations in my clients in this last 10 years. And I'm just continuing to share as much as I can, both through programs like this, both at the national level, like I said, with the Surgeon General's office, and anywhere that, that I can.
Thank you so much.
Well, thank you.
Thanks that you had to go through it. But I will say that when I was going through it, no one talked about it. Still 2014, 17. And what I was offered was medication. And I knew that wasn't the answer. I was just thinking I was severely malnourished because of the stress and like suicidal ideation. And, you're not eating, you're not sleeping. I was a surgical resident. I'm like, this is just, I don't understand how actually people can be on call and have this lifestyle and not feel suicidal, but no one else was speaking up. And it took some attendings that were willing to take me aside and say me too in order to save my life. So I appreciate you being vulnerable and sharing your story.
Oh, well, thank you for that. Yeah, I decided to make my message. And I feel that I felt selfish not sharing. You know, I said, wow, I completely turned my life around. I've lost 3 physician friends to suicide. You know, I was almost one of them. And so I really feel that, you know, I needed to go through that to help other doctors so that they don't end up like that. And that's what I've made it my life's work, to educate other physicians. And now I'm starting back at the medical student level, creating some programming for medical students as well for some medical schools. So anywhere from medical schools to attendings, residents and interns, I'm coaching through the Medical Society. And now, like I mentioned, at the national level, working with the Surgeon General's office. So it's very, very needed. And that's why, you know, this investment has an incredible ROI, an incredible return on investment, because, you know, there's nothing more important than your well-being. And it's time to be a well-being, because the world needs your gifts. You have rare and valuable skills, and the world needs your gifts. And you can't give to others when you yourself are not well. Yeah. Hello, Winnie. Hello, hello. I know that you popped in a little bit late, but I'm happy to answer any questions. I don't know if you saw any of the demonstration. I'll be happy to show it to you again if you'd like to see the program.
Oh, that's okay. Sorry, I just was late, and you don't need to show it to me again. I just wanted to catch whatever I could catch. So.
Yeah. Well, no. I mean, I'm happy to show it to you. I just went over it quickly, and I'm happy to show it to you. Let me share my screen and let me bring it back up, because that's why you're here, and I'm here for you. Can you see that?
Yeah.
Okay, great. So the backstory is that I created this program when COVID hit, because I've been teaching physicians in person for about 10 years now. And physicians frequently would need either more information because they couldn't remember what I taught them. You know, they're like, that was awesome. What did we just do? Or they couldn't make it to anything that I was teaching. And so for years, I resisted creating anything on video. And then when the pandemic hit, I said, you know what? These bad physician stats are only going to go from bad to worse. And so I developed this program. And I took all the knowledge and expertise that I've been teaching live, and I put it into an online format. And that's combined with live coaching. So you're looking at the online format. This is called RX Inner Peace, a physician's guide for self-care. And I call it that because it gives you the opportunity to write your own prescription for your self-care. And that prescription being making your own self-care toolbox that are evidence-based and culturally sensitive and just based in the medical literature. Not taking pills, not alcohol, not drugs, just working with your own anatomy and physiology in a way that we were not taught back in medical school, through our medical career at all. So when you log into your program, after you register, you get a unique login that you create, and you'll see contact resources at the top. That tab is where you log into your group calls with me, where you meet other physicians and we do group coaching together, and where you set up your private one-on-one coaching. Your program comes with 2 private one-on-one coaching calls with me that are an hour long each. And that also has the information to reach me. You know, I'm very accessible. It has my email, it has my cell phone, so that if you need to ask a question or you want to share something amazing, you can always reach out to me. And then this is the references here. So we have so many references, and that's because physicians want to know more lots of times, right? We love to know more. So I have about 10 pages here, and it's on all kinds of things. Some of it's the evidence that goes behind what I teach, and others are just more information about different subjects, from stress and coaching to pain. We go into telomeres. It's fascinating knowing that chronic stress actually shortens our longevity. It shortens our telomere length. A little story about that is that I had my telomeres checked because I wanted to know how old I was genetically compared to my chronologic age. And I'm actually 16 years younger genetically. So at 52, I had it checked and I was 36 genetically. So right now I'm 56. People frequently ask, how old are you? And they're surprised. And I have to tell you, it's related to all of these self-care tools that I implement, and I do them personally, and I share them as well. Telomeres are fascinating. The good news is you can reverse the premature shortening with your self-care. You can actually lengthen them and then become longer than your stated age like mine are. Okay, so along the left-hand side, we have these 8 modules. And as I know that we are very methodical and organized, that's how I think, I created each module with the same categories in each module, and there are different lessons in each category. The modules are broken up into these different categories, and there are more lessons in the first module because I give you introductory lessons to all of the subjects. Also, I want to share that the lessons are short because we're super busy, right? Doctors are crazy busy, and I work with the craziest of busiest of physicians, and they have time for these lessons because they are short and succinct and easy to do, actionable, easy to learn. So each module begins with a lecture. I start with the stress response. I've broken that up into 2 parts. Mudras are hand gestures. I described that our homunculus is how I base a lot of our tools, and our hands take up a large portion of our brain. Mudras are hand gestures. We do different things with our hands that can bring us to calm. I give you an introduction to seated meditation, right? Because morning meditation, starting off your day, you wake up anxious, that's going to take you into the whole rest of your day. And you don't have to sit quietly and be uncomfortable. I guide you through everything. So all you have to do is listen to me. All those preconceived notions about I can't sit quietly, my brain is too busy, I take all that out. I do it all for you. I teach you, I believe, 18 different ways to breathe, and most of them are for calming. And they're short videos, 5 minutes, 11 minutes. Most of the lessons are 15 minutes or less. Somatics. Somatics is amazing, changed my life. It's the opposite of stretching. So in somatics, I teach you the principles in a way that you can increase the resting length of your chronically tense muscles. So you actually feel better in your body. You don't feel like the Tin Man anymore from The Wizard of Oz. I actually had shoulders that were offset from an MVA from about 15 years prior to me starting this. I was able to completely relieve everything. No more chiropractor, no more PT, no more OT, no more acupuncture, no more pain medication, completely gone. So this is pretty cool. There's a 10-minute daily practice that I teach you in 2 parts, and everything is from the floor and a chair, because sometimes you can't get on the floor and sometimes you're in a place where you need a chair. And that also allows you to teach your patients, if you'd like, from a chair, which is what UNC, who accredited this program for CME, was excited about, that chair piece, so you can teach your patients. Self-regulation tools are the next category. And again, I work with a lot with the hands and the mouth based on our homunculus, the way that our bodies mapped in our brains. And then iRest meditation. This meditation was originally created for Walter Reed Army Hospital to help our military a few decades ago relieve their symptoms from PTSD, all that suffering. And it was found not only beneficial to process their experiences, but it was found to relieve chronic pain, so much so that in 2010, the Department of Defense declared this meditation a Tier 1 treatment for chronic pain. It's unbelievable, because so much of our pain comes from our thoughts, our brain, causing our muscles to tense up for that stress response, even when we don't really need those muscles to be tense. This meditation has 10 steps. I teach you all of them. I give you short guided meditations and some longer ones for sleep and daytime. And at the end of each module is the only lesson that is longer. They're usually about an hour, and that incorporates everything that I teach you in the module into one lesson, so you can integrate what you've learned. Again, that's taught from the floor and a chair. At the end of each module, there's a journal, and you can, I don't look at these, this is just for you, but it's really nice for you to take note of your stress. Just rate it in the morning and the night, track it as you go through the program, and note your progress. Note your sleep, how much better you're sleeping, the number of hours of sleep, how much nourishing your sleep is as you continue in the program. And then journaling, and there's some prompts. People really like this, where you just start to keep track of what tools you really enjoy, because there seems to be a pattern. Sometimes you'll like tools more than others. That's why I teach you so many, because some people like things and other people don't, right? It's like a buffet. Some things taste really good and some things don't taste as good. So I give you lots of tools, and it's up to you to create that toolbox for yourself based on what feels really good for your body and your mind. And then so all the modules are broken up that way, all of them, the same subjects, same categories, different subjects. And when we get to module 8, at the very end, you get to claim your CME credit. So there's a quick post-test with really easy questions, just so the AMA can say, yes, you passed, I'm gonna accredit you. We do a pre and post Maslach burnout inventory, so you can see your progress that way as well. And then you fill out your CME credit form for UNC to get your 25 category 1 CME credits. Okay. So Winnie, do you have any questions so far while I still have the program up?
No, yeah, that sounds pretty self-explanatory. Thank you.
Okay, great. So far what I described was the video components, right? And the handouts and that. And so I created that in a way for you to learn how to take over your hijack body, learn how to work with your autonomic nervous system to bring homeostasis to your autonomic nervous system, so that your stress response isn't outweighing your parasympathetic relaxation response all the time. And you can just create those default networks, get rid of that default network and create your new neurologic patterns, create your new pathways, so that you can quickly feel calm anytime you need to. The more you practice, the quicker they work. But then there's that part of the brain, right? So how do we work with our thoughts? That's where the coaching comes in. So we work with the thoughts, how to manage your mind through group coaching and through private one-on-one coaching with me. Those coaching sessions are 1 hour each, and you get 2 within your program. So 2 private coaching sessions with me, scheduled at your convenience in a flexible way, whatever works for your schedule, whatever day, whatever night, whatever time, you choose that. The group calls are unlimited. So even after you finish your program, you can always continue to pop on. I have docs that are still popping on that have finished the program several months ago. And the program itself has no expiration date. So even after you get your CME, you're still entitled to all of the content, because I don't like programs that cut you off. I've taken a lot of programs and I've really enjoyed the content, and then that's it. You don't have access to it after a certain amount of time. So the content is yours forever. The group calls are yours forever. And because I care so much, and I really, want to commend you for popping on live, for coming live and being here live to learn about this program and to take a step forward into 2022, really focusing on how you can improve your well-being and become the best version of you. The gift that I'm offering you is, if you sign up for this program by midnight tonight, you get a 3rd private session with me. And that 3rd session is worth $500, because private sessions with me are $500. And I can tell you that these sessions, physicians really find them so beneficial. I've had several clinicians that after they finished their RX Inner Peace program have continued and still continue to coach with me privately. So I am gifting you a private session in addition to the 2 that you already have, and that is worth $500. And that's because I'm really encouraging you to take that step forward. Omicron is here. It's not going anywhere. COVID's not going anywhere. Physician burnout has gone up from half to 2/3 of all docs. Depression is 89%. Suicidal ideation is up. Suicide was already twice the national average. So it's time for us now to really take care of ourselves. And this is my gift to you. So in the chat box, I put the link to register. Again, if you register by midnight tonight, you will get an additional private session with me, which is a $500 value. Okay. So do you have any questions, Winnie, Anything else, Jillian? Anything coming up?
I don't have any questions right now. Thank you.
Okay.
Yeah, thank you.
Okay. I'm looking to see, I had some other questions come in from the last demo I did. I just wanted to see if there's anything I didn't cover that might come up in your brain. Oh, when can I start? I get that question a lot, right? So initially I had the program starting and stopping during different times, but then physicians would say, I can't wait 1 month. Like, I'm stressed out now. Like, I'm not feeling good now. I'm exhausted. I need help. And so the program is evergreen, which means that as soon as you register, you will get an email that has you fill out a quick intake form, and then you'll get a link to create your unique login. So as soon as you want to start, it's yours. How long do I have access to the materials? We talked about that. Forever, right? Even after you get your CME. I get questions about, well, how long do I have to complete it? We put a 6-month time slot on that. Almost all physicians have completed it in less than 6 months, some quicker than others. There's no race, right? But usually the 6-month mark is a good mark, and I haven't had anybody that has had an issue with that. One person needed an extension due to a family issue, and that was no problem. She got an extension. Do I need to know anything ahead of time? No. So as a matter of fact, I encourage a beginner's mind, taking off all hats that you may have coming into the program, because when we have a beginner's mind, we're more likely to really absorb and learn and grow. And I get this, how long before I feel better, right? How long before I feel better? Pretty quickly. Most physicians in the very first week of starting to practice these tools are noticing a shift, are noticing that they're calmer, are noticing that they have more patience, that they're not reaching for all that junky, yucky food, that they're eating better, that they are less reactive, really pausing before they speak, not saying things they wish they could take back, getting more sleep and not waking up tired. That's a big one, right? Do I have access on all platforms? Yes. So all platforms, whether it's desktop, laptop, phone, or tablet. Oh, how much time per day is needed? I get that question a lot. It's really a matter of minutes, whatever you have time for, right? This is your program. So I've created it so that you can learn something new in a very short way. If you choose to learn something new every day or every other day, or maybe every 3 days, it's really up to you. And then you can start implementing these actionable tools while you're doing other things, while you're sitting talking to a patient, while you're driving in your car, while you're emptying the dishwasher or folding your laundry or walking your dog or talking to a patient, right? So these tools that you learn become ways of life. They become lifestyle changes, just like brushing your teeth. Like you probably wouldn't not brush your teeth, right? So what happens is you start to do these tools automatically. You start to recognize when you're, okay, I am not here right now, right? I am not where I'm supposed to be. And I'm going to fix that because I know exactly what I need to do to fix that. Okay. What else? Can I teach my patients, kids, and staff? Yes. It's an amazing ripple effect. Amazing ripple effect I've seen. I don't know if you've listened to my podcast. I have the Stress Free MD podcast, which is also now for CME. And there's an episode I did where I talked about how I was able to teach a certain breathing tool that I teach you in the very first module to someone on a plane next to me. The pilot was going to have to land the plane because this person next to me was wigging out, and I was actually able to teach her how to do this specific breathing tool to calm her down so they didn't have to land the plane. And then a physician heard that podcast episode and actually was on a plane and taught someone else that same breathing tool and then didn't have to land the plane. So it's pretty cool that you can teach, other people, whether it be your patients, whether it be a layperson, whether it be your kids. I've heard lots of people say that their kids have less text anxiety or performance anxiety with sports now. So yeah, the ripple effect's amazing. And of course, your patients. What if I have a question I need answered about the program while you're in it? Yeah, so in that contact tab in the program, you have my email, you have my cell phone number, and you just reach out to me. If you want to ask me a question, if you're stuck on something, if you want to tell me how great you're doing. I love hearing that too. And is this program only for physicians? Yeah. So this program is only for physicians. I've had a lot of inquiries from other healthcare professionals and from lay people about the program. And I really create a safe space just for doctors. I'm not in it just to get all the money that I can get. I only keep this for doctors because I want doctors to feel safe, particularly in our groups. I want them to be able to share. I don't want them to have the feeling that they can't speak openly because others won't understand them, or they're embarrassed, or they feel ashamed. This is completely for physicians only. I have other programs that non-physicians can have access to, but RX Inner Peace was created by a physician for physicians exclusively. Okay, so those are the other questions that I frequently get, just in case any of them popped up in your mind. Again, the link for the program is in the chat box, and it's there for you to register. If you register by midnight tonight, I am, from my heart, giving you a third private session with me, which is a $500 value. Well, thank you again for coming. Thank you so much for being here live. Thank you for all you do. And I'm here to support you any way I can. Please reach out if you have any questions. Thank you. Have a great rest of your night.